We launched a $140 million electronic medical record project across 3 health services during a global pandemic.
Putting the EMR into one hospital is really very challenging. Putting into 3 hospitals simultaneously is really ambitious. I mean, doing that in the middle of a global pandemic is unprecedented.
Before the EMR, and ever since I can remember, we have documented everything on paper.
When we work from paper, a patient has to constantly retell their story. And often the response we might get from a patient is, "I've already said that."
So an electronic medical record is all of that information in one place at the clinician's fingertips.
It actually guides care and helps provide safe care, helps clinicians make decisions, as well as keeping that record of what's happened to the patient.
This is 4 hospitals coming together and working on one system. So that is actually a massive project.
Back in January 2020, I was extremely confident that the go live was going to happen in May and it was going to be successful.
The system was ready, we'd recruited our trainers, we'd started training, so we were ready.
And then the pandemic hit, and as we nervously watched the numbers around the world rise,
there was an enormous amount of anxiety across all of our Parkville precinct partners.
The inevitable peak in cases of COVID-19, the pressure that will bring to bear on our public hospital system will be enormous.
Our biggest concerns were if all of healthcare workers are not at work, if the hospitals are overrun, can we implement a very, very big project like this?
Making decisions around, was it safe to go live? Would we have clinicians trained? What was safe for patients within that environment?
I think the project team needed time to really redesign what our training, our go live support and our implementation strategy was going to be with COVID.
We all appreciated that the sooner we could get this in, the easier it would actually be to provide care in a COVID environment.
When COVID started to pick up in Victoria again, we were all nervous.
Victoria has recorded a major jump in coronavirus cases.
It was a perfect, absolutely perfectly scripted collision course.
I don't think anyone would have planned or predicted for those 2 events to come together.
People were still quite nervous about going live, and we were seeing COVID numbers going up and up.
I was feeling very, very anxious, I have to say. Many, many sleepless nights.
Particularly for our Royal Melbourne colleagues who were under serious pressure in responding to the pandemic.
They were so courageous and they were in the midst of a terrible time, and they still went for it, and their courage is one of the things that make this work.
They were quite clear that we were ready and this was the time to do it, and we were going to do it in COVID anyway, so let's just get on with it.
It was tremendously exciting. I mean, it was several years of work culminating in that overnight period where we went live with the EMR. And bringing the hospitals together.
The mood was quite significant. Everyone was happy we did it. There was, a silent roar across the organisation.
If we think about the environment that we went live in, I don't think that the project could have gone any smoother than it did.
I'm really proud of all of our colleagues, of the work that people have put in, the investment that people have put in.
The EMR project has been successful because of the resilience of the staff in the precinct.
I think it takes commitment.
It takes an incredible amount of cooperation.
Our staff here really did go above and beyond.
But that's just the beginning. The real improvements, innovations, improvements to patient care, safety, research, they're coming now, and they'll deliver them for the next 20 years.